Next to speak is another very good friend of mine, Dr. Dan Popowich. He too has been through a couple changes in his career, and he'll tell you about them, I hope. But what we agree upon, and you'll see in there, is that there are some key elements that we have to have in order to be successful, which will touch on all this. So he's going to tell us about what it's like to build that practice up and then maintain it based on his experience.
Thanks, Brian. Thank you all for sticking around. As I was listening to Aaron's talk, it took me back to the 4 years ago when I went through all this, and it reminded me again now how, at least for me individually going into medicine, I just want to take care of patients. I just wanted to sign that first contract to just be done with it and not look at it. So I made some of the mistakes that you're not supposed to do. But even now, I just want to take care of patients, and I don't want to have to think about a lot of these difficult aspects on how to take care of patients, especially in the market that we are living in and practicing medicine in. But I realize now that I wish that I paid attention to some of this stuff, or if it was even offered to me. So hopefully, especially for the people who are coming out, I'll have some tips for you to help you to negotiate this stuff and just take care of patients. So I have no financial disclosures. I really have no disclosures other than I have worked in an academic setting, and I'm currently working in a private practice setting. And both of these settings for me were in are big cities with lots of competition. So surgery is a collegial profession, and you have to remember you are operating on somebody else's patient, and they have to decide who they're going to send their patients to. Okay. Marketing for a surgery practice must enhance your reputation and concentrate on establishing and enhancing the physician referral relationships. Surgeons need to have a coherent and compelling message. You need to convince this referring physician that you are the person that they should be sending their patients to. So a common source of early referrals, if you join a practice, you will, they will already have established, and if they're willing to share with you, you will start getting some patients from that. A colleague from a different field who you might have trained with, who's in the same area and you finished around the same time and they just know you. On-call is a very good way to help build a practice, and I'll talk about this a little bit later on. But this is a non-competitive way to get to meet a patient and then refer back and communicate with that patient's physician. And if they don't have a physician, you can recommend a physician, and then you can build upon that. These can get you your foot in the door, but it's usually not enough, okay? So this is sort of the outline slide of everything I'm going to talk about. So when you first start out, after a couple of months anyway, I think it's important to track your referral sources. You want to educate your referral base. You want to establish yourself as an expert in your field, okay? That being said, you don't want to be too specialized, especially not initially coming out. Make it clear to your referring physicians what sets you apart. This could be a clinical niche, or it could be the quality of service that you provide. You want to make the process for the referring physician and the patient to be easy, enjoyable, and effortless, something that is just one phone call and it's taken care of. And you want to return the favor when able. Like Aaron was talking about before, you always want to keep your eyes open for new opportunities. I'm not talking here about switching jobs, but finding more referrals. So first step, tracking your referrals. Do you know who is currently sending you patients and why? So very often you'll see that a lot of your referrers are just coming from, based upon that's the physician's preference. I like calling this guy because I always have, because I asked somebody else when I first started in practice and that's who they sent it to, and it just continues that way. We have a good opportunity in a setting like this to jump in on that, because they're just sending patients that way because that's what they've always done. They don't really even know what is being done to that patient or what the results are, but that's what I do and that's how it's going to continue. A lot of it is going to be also from the insurance plans, at least in New York. A lot of patients just show up in your office because they said that they looked in the Blue Cross brochure and my name came up, and that's how they ended up in my office. And a lot of it also will be patient-driven. I don't know about the other areas in the country, but in New York City, a lot of patients just show up directly to your office because they found you. Does your office have a system in place to track this information? And it doesn't matter how you track it. It's just important that you do. For me anyway, I have an Excel spreadsheet that I've tracked every single patient who's ever come to my office and who the referring physician is and what the contact information is, and I find a way immediately after seeing the patients to get back in touch with that physician right away. So monthly reports will quickly tell you where your referrals are coming from and who the top are. Typically, about 80% of your patients will be coming from just 20% of your total refers. Okay, and this is sort of a slide that helps you to sort of look at this, where there's a small group of physicians over on the left-hand side that are giving you about 80% of your practice or 80% of your revenue, depending on how you look at it. And these are the people who you really want to focus on taking excellent care of, because if you lose one of those people, that could be a big hit to your referral practice. And you also want to concentrate on the people on the right-hand side and try to move them over. So overall, tracking your referral sources will help to measure the effectiveness of your marketing efforts and figure out where to best direct your future resources and time. You want to educate your referral base. This is a very good opportunity for those of you coming out of training. It's something that I did a lot of. I had a mentor who really helped set this up for me, and it is absolutely something you want to do. The more your referral source understands about you and your specialty, the more they're likely to refer you patients. Physicians feel more comfortable referring to patients that they feel are familiar and are an expert, okay? So one of the hard things about this, and Aaron touched upon it in the last talk also, is, and it was brought up at the end, know your worth. It's very difficult at any given time to say to yourself, I am the best at what I do, okay? But your referring doctors don't know this information, okay? A lot of us in this office, in this meeting, excuse me, are double board certified, all fellowship trained. We are excellent at what we do. And you just have to own that. And you have to tell people that, okay? And don't be embarrassed about it. So offer to speak at your regional or state medical society. They are always looking for more people to give talks. Volunteer to give grand rounds at your own hospital or neighboring hospitals, okay? Create and distribute a newsletter. This is a lot of work and it can be overwhelming to do, but it is a really good thing to do, to send it out, even if it's something that just comes in an email for referring physicians that just keep seeing something that, oh, Dan Popowich sent me another thing about a cool surgery that he's doing. It's a good way to stay relevant. And one of my favorites, you just go and meet with people. Go have a drink. Become friends with them. Don't be too specialized, though. Say yes to the bread and butter consults. Once somebody sends you a patient and you do an excellent job and they like what you have done, and then they send you, you know, I'm a colon and rectal surgeon, and, you know, they'll send you hemorrhoids or something like that, which I like doing anyway, no offense. But there should be no referrals that are beneath you or not worth your time, because it's, as much as you're still taking care of the patient, you're also maintaining that relationship with your referring physician. And you want to treat these patients with the same enthusiasm and care as you do for the ones that you really want. I'm not going to get a J-pouch, you know, every day. So you have to really show that you're going to give the same quality of care throughout. Set yourself apart, okay? What sets you apart? Is it a particular niche? Is it that you are willing to do something that others don't want to do? Or is it the quality of service that you provide? You don't want to be that person, okay? So how to stand out? You want to treat your providers and their patients the way that you would want your patients to be treated. And you make sure that yourself and your practice stands out from other competing providers by exceeding their expectations. So how can you exceed expectations? Create an easy system for referral sources to schedule your patients with your office. Be available and accessible. Provide prompt, timely, well-written, and understandable reports to the referral sources. So an easy referral system, reduce the amount of work that it takes to get a patient into your office to be seen. Educate your office staff how you want it done. I tell my office that I don't care what time of day it is or what day of the week it is. If someone calls with a patient that needs to be seen, I will see it. Okay? It is definitely worth your while to have your staff be on your side with this, because often all it takes is one interaction with a referring physician who calls your office to make an appointment, and your office tells them, no, he won't be available till next week, and that's it. You'll never get another phone call. Offer to make the appointment for them. This is including if a referring physician calls you directly on the phone and says, hey, Dan, I've got this patient. Say to the guy, hey, give me the patient's phone number. I'll set it up right now. Don't say to them within reason. Don't say to them, okay, we'll just call the office. You know, they called you because they want you to do this for them. Offer to call the patient yourself. Be available and accessible. I'm glad my wife is not in the audience for this part. Okay. But be willing to see patients at the convenience of the referring physician. Okay. They don't know what an emergency is. They just know that they are looking at something that you are supposed to take care of for them. And they want it done now, so do it now. Do it as reasonably timely as you possibly can. Show them that you're going to make that extra effort. Give out your cell phone number, okay? And pick up the phone when you are called. Offer to see the patients on the same day. Offer to see the patients on non-office days. Okay? Communicate back. Get the results of the consult back to the referring physician fast. Use any modality necessary. Okay? Fax and email are the most practical. Call if there's going to be a delay otherwise in getting a result back. Calling obviously is important if there's an urgency, and it's also the most personal, but we're all busy. So sometimes it's not reasonable to call someone and have them pick up the phone, and you're not going to leave a 10-minute story on a voicemail, okay? Learn how your referring physicians like to communicate, and then continue it that way, whether it's over the phone, faxing, email, texting, which is very big where we are, or none. I have a couple of referring physicians who really don't care to hear back from me, you know, about having seen a patient. They just want to know that it got taken care of, and that's enough. Go the extra mile, create buzz. The best marketing is word of mouth or buzz marketing. This is probably going to be addressed in one of the later talks. But if you provide good service, people will talk about it, and then that will spread. Physicians who know their patients are truly cared for will appreciate, and they will spread the word. Okay, a lot of the times, you know, if you think about it, if you see a patient who needs a consult and you don't know that specialty, you'll ask one of your colleagues and say, hey, who do you use for this? Because you just want that opinion of someone who you trust, and then you'll just start sending patients that way. Well, it works the same way for us. Make it real. Show them what you can do. And I just put a couple of examples up here. I take a lot of pictures in the operating room. A lot of your referring physicians do not know what it is that you do, but it's actually cool. They remember medical school and their rotation, and they might have had an experience about it, and it's kind of thrilling. Sometimes it's gross, but you know, show them what you do. I have just cases from last week. It was a gallbladder. I've never seen that many stones before. I thought that was pretty cool, and that was the cholangiogram that I shot, and there's a tiny little stone down there, and I show all this to referring physician and admit the patient to the hospital, get them an ERCP. It makes it real to them that they were there and they know. So when the patient comes back to their office and they tell the story about what had happened, it's like they were there. It also gives you an opportunity to show what you can do that maybe others don't do. Obviously here at this meeting, probably everybody does single port surgery or smaller incision surgery than I do. But this was a cool case on a young guy with very bad Crohn's disease, and you know, you can barely even see his incision there 2 weeks later. And I like showing this to the referring physicians because, you know, they might remember that, oh, everybody who I used to send this to came back with a giant incision. Keep in touch. This includes when you see patients, path reports come back, they get readmitted to the hospital, they just call you up, call back the referring physician, let them know what's going on. And then sort of the water cooler, when you're just taking a break and you're just out getting lunch and you bump into someone, use that as an opportunity to tell them stories about other patients you've taken care of and the results, to share your good results with them. You want to say thank you and you want to return the favor. We do have the opportunity to return the favor back to our primary care physicians within reason. Use them for your preoperative clearance. Have post-op patients go back for new baseline appointments within a reasonable timeline. That's the freshest time that the patient is going to be able to talk back to the referring physician about what their experience was. Identify other health maintenance needs that your patient might have. For me as a colon and rectal surgeon, I'm always asking people whether or not they're up to date with their colonoscopies, and it gives me a great way to get in with a bunch of gastroenterologists just by sending them for colonoscopies. Keep your eyes open, okay? Offer to take more call. I know that this might not make a lot of you happy, but it's a good thing to do. It really is. Cease referring to your local competitors, particularly if you're in private practice. Ask who your patient's primary care physician is, even if she's self-referred or referred by someone else, because it gives you the opportunity to talk to another physician. Like I was mentioning earlier, a lot of patients will come into your office from having found you on ZocDoc, and their primary care physician doesn't even know that they went to go see you. But use that as an opportunity to call back that person and say, hey, they found me and this is what we're going to do. Establish an online presence. This is going to be talked about later, but you want to get that 5-star rating, okay? And go back to step 1. I don't mean just on this page, but all the way back to the beginning with tracking your referrals. And that's it. Thank you, guys.
So, again, amazing amount of wealth and knowledge in that lecture. I think that stuff is very, very practical. Of course, certain practices are set up differently, where you can walk into an institution and all they just have is a ton of volume for you to do, and there's no referrers at all. But again, getting the trust of your colleagues within that institution is the same principles. So thank you very much. That was a terrific talk.